HIV is the human immunodeficiency virus. It infects the blood and attacks your immune system. If left untreated, over time, HIV can develop into full-blown AIDS. This develops when your CD4 cell count drops below 200. At that time, any one of a number of opportunistic infections can attack your body.
Nobody really technically dies of AIDS. They die of these opportunistic infections, these rare cancers, these rare pneumonias and things like that that just overtake and ravage the body.
Knowing precisely what HIV does is the first step. Now you must be able to separate the facts about HIV from the myths that have continued to spread over the last 25 years.
We hear a lot of myths. We get a lot of calls here and through our local health units about in the spring when the mosquitoes start. I mean, that's always been a myth that mosquitoes, transmit HIV, and it is a blood disease. But people think that because a mosquito bites them that they're going to wind up with HIV. Not going to happen.
We know if mosquitoes transmitted it, everybody in Searcy County or everybody in Lonoke County would be infected with this virus. It just does not happen that way. Transmission does not occur by casual contact, drinking after somebody, eating after somebody, hugging somebody.
There are students who will inquire and ask about, can I get HIV from restaurant utensils if they weren't properly cleaned, drinking from the same glass, from hugging somebody, shaking hands with somebody who's HIV positive. Can I get it from a toilet seat?
The old theory of contracting it in public restrooms, not going to happen.
At one point somewhere I had read where in order to actually contract HIV, enough of the virus to be at risk from saliva, that you literally would have to drink a gallon of somebody's infected saliva, which I can't imagine anybody doing that.
Those are all myths about how HIV is spread. The next myth centers on the misconception that a cure has been discovered for HIV. This myth has come about largely due to new HIV medications that help infected people lead normal lives.
One of the negative aspects here in Arkansas that we've been trying to combat is that people with the new treatments have really misunderstood what the treatments are and think that it's a cure. Think that the epidemic is over and that there's nothing to worry about.
There's a lot of people that already think there's a cure because they think Michael Johnson is cure. He's not cure. He's just taking care of himself. He's taking his meds like he ought to be taken.
Students today kind of see HIV/AIDS like any other disease, and some of them honestly think because they see so many individuals who have come out openly about their HIV positive status, living healthy lifestyles, that they don't realize the detrimental aspects that this disease can have on one's life.
Another myth began as something many Americans believed was a truth.
This is not a gay disease. It is everybody's disease. And people need to know that. They need to know that this is not a joke. This is real life, and it needs to stop. If we don't stop this disease, it won't never go away.
After looking at the myths of HIV and AIDS, you must now identify the facts.
HIV is transmitted through a couple different primary means. One is sexual. The other main means here in the United States would be amongst injection drug users who share needles. A pregnant woman can transmit it to her baby through vertical or perinatal means. Rarely these days is HIV transmitted through a blood product or through transfused blood. We have such careful screening procedures these days that rarely happens.
Knowing how HIV is transmitted is important, and knowing how to prevent the spread of HIV is equally important.
Abstinence would be a surefire 100% way to protect oneself from getting HIV sexually. If that's not an attainable goal for a particular individual, then certainly condom use reduces the rate of HIV transmission. It's not 100%, but it is. 100% condom use is very effective at preventing HIV transmission. So I think safer sex practices have to be a major point when we talk, especially to young people.
The studies bear out that if condoms are used appropriately, transmission doesn't occur.
Always protect yourself and do what's safe, and for the kids and possible to practice abstinence. Don't treat this as a scare thing. Go get tested, and you still can live a normal life if you want to.